Hello and welcome to this video. We're going to be discussing two clinical cases in relation with salivary gland tumours. Salivary gland tumours, the most common are typically benign, and the most common is pleomorphic adenoma, but the most common malignant type is the mucoepidermoid type of tumour. Now, salivary gland tumours can occur in our three salivary glands. So they can occur in the parotid gland and present as a swelling in front of the ear. They can also occur in your other two glands, which is the submandibular and the sublingual gland. So let's move on with the case. A 79-year-old man has a swelling on the right side of his face. This swelling has gradually increased for 3 months. He complains of weakness, fatigue, but I was supposed to take that out. He doesn't have a complaint. Denies any facial weakness, dysphagia, or pain, or fever, or weight loss. So he doesn't have any constitutional symptoms. On exam of the right side of his face, there is a mobile, which is movable, non-tender swelling in the right parotid region. The patient also has a 60-pack-year history of smoking. So this is a greater age of a man, so someone who's slightly more elderly male, plus 60-pack-year smoker history. So if you know, you know, and if you don't, get to know. This is a very characteristic, typical presentation of a certain type of tumour of the salivary glands. So when it's an elderly male who is also a smoker and then has this fast-growing tumour, this is Wharton's tumour. This is Wharton's tumour. Wharton's tumour is a benign tumour, and it's a benign neoplasm. What makes this tumour benign? Well, there's a facial swelling. A quick increase of a facial swelling with 3 months is pretty fast growing, without significant pain. So it's basically a fast growing tumour which has not yet infiltrated or not presented with. Actually, you know what, 3 months in this grand scheme of things doesn't have to be fast, but it can be gradually growing. So it's a growing tumour yet not yet infiltrated into the facial nerve. So that is a benign tumour, something which is more gradual growing, something which is more slow growing. And it also has lack of invasion, lack of infiltration into the facial nerve. Now, anyway, Wharton's tumours are common in males, older age, and smokers. The mnemonic here actually is warriors from Germany live for smoking. From Germany live for smoking. And this is because warriors reminds you of Wharton's tumour. From Germany reminds you that these are tumours which have germinal centres. And they live for smoking, meaning this is common in smokers. Next case. To the clinic presents a 60-year-old man with diffuse swelling on his left parotid gland. Here it is. And the patient also complains of facial numbness and pain. He has a left-sided facial for palsy. What is the most likely diagnosis? So if it has infiltrated the surrounding structures, that is typical of what kind of tumour? A malignant tumour. And it hasn't just invaded any of the surrounding structures, it's invaded the facial nerve. So when it invades the facial nerve, this is also typical for one specific form of malignant salivary gland tumour. So this is the answer. This is an adenoid cystic carcinoma. An adenoid cystic carcinoma. It is the one of the common malignant tumours, not the most common because the most common is mucoepidermoid. Which tumour type is most likely to invade the facial nerve? Adenoid cystic carcinoma is most likely to invade the facial nerve because it can then lead to facial nerve palsy as well. Adenoid cystic carcinoma are malignant forms of tumours of the parotid gland, and this patient likely does have a malignant tumour of the parotid gland with this swelling, with this fast-growing swelling, which is diffuse as well. Okay, diffuse can either be multifocal. Why is this not pleomorphic adenoma? Pleomorphic adenoma is benign. Okay, so it will not invade the facial nerve. It will not infiltrate the surrounding structure or the structure within the parotid gland itself. That's where the facial nerve is. Wharton tumours are common in elderly men. This is my copy paste. Common in elderly men and smokers. So Wharton tumour is the one we discussed up there, which was common in elderly males who are also smokers. Adenoid cystic carcinoma is a type of malignant tumour. Now, I don't know why I put Wharton's here. The other malignant tumour is mucoepidermoid, okay? What will you do for this patient? You will do investigation, take the patient history and do a thorough physical exam with checking, making sure to check the lymph nodes in the neck completely. And there are some red flag symptoms where, well, when we first take a patient history, you want to ask, was this always the site of the lump? Is this the site of the lump? Is the lump still there? How has the lump grown or progressed in size over time? So you want a size over time kind of picture in your mind. You can draw a graph. Okay, what are some of the red flag symptoms in a lump? When there's stridor, hoarseness of voice, because you know this can involve the recurrent laryngeal nerve or any of the nerves, okay, within the throat. So it's mostly the recurrent, sorry. Otalgia or odynophagia, pain on eating, and dysphagia. These are the red flags. If they are there, you want to be have a high clinical suspicion. And the constitutional signs and red flags. The constitutional signs and symptoms are weight loss, night sweats, anemia, and anorexia. Just check with that. Then you can do a biopsy. Your management. Okay, if there is a salivary gland swelling present for more than 1 month plus, it should be removed, especially if it has no underlying cause. You can also do a total parotidectomy as a surgeon. I just want to quickly go over why the facial nerve gets involved in these parotid gland tumours. Here's the facial nerve, which is running through the parotid gland, and if there is a tumour here, that is going to obstruct the branches and impinge on the facial nerve branches. That will lead to a facial nerve palsy. A facial nerve palsy, how does it typically present? Well, there's an absence of forehead wrinkling. There's a drooping eyelid. There is facial paralysis and weakness and a drooping cheek here and a drooping corner of the mouth. This is also due to facial nerve palsy. So you can see these in Bell's palsy as well, can't you? The forehead wrinkling, absence, and a drooping mouth and the drooping eyelid. So remember this. This is very characteristic of a facial nerve palsy. So it would help you to imprint this into your mind. And the other, just to look out for the symptoms of salivary adenoid cystic carcinoma, you can have facial weakness and numbness, dull pain in the face, facial paralysis due to the facial nerve palsy, difficulty swallowing, dysphagia, and trouble opening the mouth. Hope this video was useful. Keep watching for some more surgery videos. Thank you and take care.